Welcome to Sato Career Online Nursing Channel. We are having less than 48 hours to give our Safdarjung Nursing Officer exam. Sato Career Online Nursing Channel is dedicated to give very good questions for those who are preparing for any kind of nursing officer exams. In that way, we have decided to make 150 MCQs as a pro questions for Safdarjung Nursing Officer exam. This is our part 1 video which contains 50 MCQs from various disciplines of nursing. Let's go for today's video. The first question, the main mode of transmission of hepatitis B is blood, saliva, urine, sweating. The right answer is blood. The question number 2, giving the infant other foods and liquids along with the breastfeeding is termed as option A weaning, option B bilevel feeding, option C is complementary feeding, option D is formula feeding. The right answer is complementary feeding. Question number 3. The drug which is administered at birth to prevent potential problems of abnormal bleeding is option A injection tranexamic acid, option B injection ethamycilate, option C injection vitamin K, option D is injection streptokinase. To prevent potential bleeding in newborn baby, after birth we used to give injection vitamin K. The right answer is vitamin K. Now question number 14. Question number 4. Postural hypotension is defined as fall in systolic BP by dash mg or diastolic blood pressure by dash mg within 3 minutes of standing from supine or sitting position. Option A 20, 10, option B 10, 20, option C 10, 10 and option D is 20, 20. We all know in postural hypotension there will be fall in 20 milligram of systolic blood pressure and diastolic blood pressure will fell down up to 10 milligram within 3 minutes of standing from supine position or sitting position. Now question number 5. Which among the following is not a manifestation of hyperlipidemia? Option A corneal arcus, option B xanthelasma, option C is xanthoma, option D is erythema marginatum. Which among the following is not a manifestation of hyperlipidemia? The right answer is erythema marginatum is not the manifestation. Baki all other things are the clinical manifestation of hyperlipidemia. Symptoms like corneal arcus, xanthelasma and xanthoma are related to hyperlipidemia manifestation. Now question number 6. Which of the following is most appropriate diet for a patient with active upper GI tract bleeding in the first 24 hours of admission? Option A regular diet, option B broad diet, broad diet, option C is bland diet, option D is nothing by mouth. So the right answer here, so most appropriate diet for patient with active upper GI bleeding in the first 24 hour is nothing by mouth. So we must keep the patient nil per oral for after admission first 24 hours. In first 24 hours. Question number 7. Which of the following laboratory finding is a primary indicator of pancreatitis? Which of the following laboratory diagnosis is a primary indicator of pancreatitis? Option A elevated AST, option B elevated serum lipase, option C is elevated ALT, option D is elevated blood urea nitrogen. So here the important laboratory finding we should expect in case of pancreatitis is increased serum lipase level. So elevated serum lipase level should be noted as a primary indicator of pancreatitis. Question number 8. Most effective coping strategy during stressful circumstances that are uncontrollable is option A avoidance, option B emotion focus coping, option C is depression and D is projection. Read the question carefully to to select the which is the best coping strategy during stressful circumstances that are uncontrollable. Avoidance, emotion, focus, coping, depression, and projection. The right answer is depression is the most effective coping strategy during stressful circumstances that are uncontrollable. Now, question number 9. Identify the correct definition of Cullen sign. Identify the correct definition of Cullen sign. Option A, bluish discoloration of the left flank region. Option B, bluish discoloration of vagina. Option C is pulsation around the cervix. Option D, palpation of right lower abdomen pain in the left lower abdomen. That is, there will be a when you palpate lower abdomen, the pain will be transferred to the left lower abdomen. So, in this, which is the right definition of Cullen sign? The right answer here is bluish discoloration of the left flank region is the correct definition for Cullen sign. Question number 10. Use of pain scale is an example of adherence to dash intellectual standard. Use of pain scale is an example of adherence to dash intellectual standard. Option A specificity, option B accuracy, option C responsibility, option D is consistency. Use of pain scale is an example of adherence to consistency intellectual standard. Question number 11. Solution of choice for bladder irrigation for a patient who is undergoing transurethral resection of prostate. Option A, oral. Option B, glycerol. Option C, normal saline. Option D, isolate P. Solution of choice for bladder irrigation for a patient who is undergoing transurethral resection of prostate includes the right answer here, glycerol. Now, question number 12. Apgar score helps to assess depression of option A cardiopulmonary functions, option B psychomotor functions, option C integumentary functions, option D is cardiopulmonary and neurologic function. Apgar scores helps to assess depression of cardiopulmonary and neurologic function. Question number 13. Primary postpartum hemorrhage occurs within dash hours of delivery. Option A 6 hours, option B 8 hours, option C 12 hours, option D 24 hours. Primary postpartum hemorrhage occurs within 24 hours of delivery is the right. So, primary postpartum hemorrhage occurs within 24 hours after delivery. Question number 14. A client is receiving IV calcium gluconate for pregnancy induced hypertension. A client is receiving IV calcium gluconate for pregnancy induced hypertension. Plan of care throughout injection of the drug must include Plan of care throughout injection of drug must include option A ECG monitoring, option B is ventilator assistance, option C is central venous pressure readings, option D is continuous CPR cardiopulmonary resuscitation. So a client who is receiving IV calcium gluconate for treatment of pregnancy-induced hypertension, the plan of care throughout injection of the drug must include ECG monitoring because it may cause cardiac problems. So ECG monitoring is regularly done till the calcium gluconate is administered for the patient with pregnancy-induced hypertension. Now question number 15. There is a best prophylaxis for a 3-year child with febrile seizure is option A benzodiazepine, option B is paracetamol Q6H, option C is paracetamol and nitrazepam administered together, option D is phenobarbital. Best prophylaxis for a 3-year-old child with febrile seizure. The right answer is administering phenobarbital is the best prophylaxis for a 3-year-old child with febrile seizure. Question number 16. Which of the following site must be avoided giving IM injection to a 2-year-old child? Which of the following site must be avoided giving IM injection to a 2-year-old child. Option A, ventrogluteal muscle. Option B, deltoid muscle. Option C, dorsogluteal muscle. Option D is vastus lateralis muscle. So for a 2-year-old child, avoid giving injection at dorsogluteal muscle because it is not much developed comparing to other muscles. Question number 17. Defenses which help maintain urinary tract sterility includes all except. Defenses which help maintain urinary tract sterility includes all except option A, adequate urine volume, option B, alkaline urine, option C is complete bladder emptying, and D is uretrovesical junction. The right answer here is alkaline urine is the best defenses which help to maintain the urinary tract sterility comparing to all other options given here. Question number 18. In which hepatitis ground glass appearance of the hepatocytes can be seen? In which hepatitis ground glass appearance of hepatocytes can be seen? Option A, HAV, option B, HDV, option C is HBV, and D is HGV. The right answer here, HBV, is a type of hepatitis in which ground glass appearance of hepatocytes can be seen. Question number 19. Following fibro-optic colonoscopy patient reports increasing abdominal pain. The patient followed by fiber optic colonoscopy reporting there is increased abdominal pain, fever and chills. Which among the following complications need to be suspected by the nurse? Option A, bowel perforation. Option B is pneumoperitoneum. Option C is paralytic ileus, and D is diverticulitis. So a client followed by colonoscopy, fiber optic colonoscopy, complaints, increased abdominal pain, fever, chills, then the nurse must be suspect for bowel perforation. The right answer is bowel perforation is the most common complication for a client who is undergoing fiber optic colonoscopy. Question number 20. Patient complaining of pain in lower abdomen with malaise, semi-solid stools with an offensive odor, blood and mucus organism responsible is option A, hookworm, B, tapeworm, C, entamoeba histolytica, option D is plasmodium. So a patient who is complaining of pain in lower abdomen with malaise, semi-solid stool with an offensive odor. So blood and mucus organism which is responsible for causing this problem. The right option here is entamoeba histolytica. Question number 21. AED stands for option A, assisted external defibrillator, option B, automated external defibrillator, option C is asynchronized external defibrillator, and D is none of this. AED stands for automated external defibrillator. Question number 22. When Allen's test is performed, option A, before venous line insertion, option B, before central venous pressure line insertion, option C, before femoral arterial line insertion, option D is before arterial blood gas sampling. When Allen's test is performed, Allen's test is performed before ABG sampling, arterial blood gas sampling, we perform Allen's test. Question number 23. Organism commonly responsible for lung abscess is option A, staphylococcal pneumoniae, option B, streptococcal pneumoniae, option C, pneumococci, and D is meningococci. Organism commonly responsible for lung abscess is staphylococcal pneumoniae. Question number 24. Indication for hysteroscopy is here, not heteroscopy, it is hysteroscopy. Indication for hysteroscopy is option A, vaginal fistula, Option B, investigation of the cause of irregular bleeding per vaginum. Option C, cervical stenosis. Option D, dysmenorrhea. Indication for hysteroscopy. Indication for hysteroscopy is vaginal fistula. Vaginal fistula is the best indication for hysteroscopy. Question number 25. Pelvic inflammatory disease can be caused by all of the following except. Pelvic inflammatory disease can be caused by all of the following except. Option A, illegal abortion. Option B, sexually transmitted infection. Option C, infection of the lower genital tract. Option D, the insertion of intrauterine contraceptive device. Pelvic inflammatory disease can be caused by all of the following except infection of infection of the lower genital tract. Except infection of the lower genital tract, pelvic inflammatory disease can occur. Very important, note the except. Question number 26. All of the following are the effects of polyhydramnios except. Option A, lung hypoplasia. Option B, fetal distress. Option C, meconium staining and amniotic bands. Option D is macrosomia. All of the following are the effects of polyhydramnios except. The right answer is macrosomia. Except macrosomia, lung hypoplasia, fetal distress, meconium staining and amniotic bands are the effects of polyhydramnios. Question number 27. Hydatid-form mole is an abnormal condition affecting option A, amnion, option B is villi, and C is blastomere, and D is chorion. Hydatid-form mole is an abnormal condition which affects the chorion. Hydatid-form mole is an abnormal condition which affects the chorion. Question number 28. The percentage and the flow of oxygen in a red color venturi mask is option A 31 percentage and 6 liter per minute. Option B is 35 percentage and 8 liter per minute. Option C is 40 percentage and 10 liter per minute. Option D is 60 percentage and 15 liter per minute. The percentage and the flow of oxygen in a red color venturi mask, the right answer is 40 percentage and 10 liter per minute. Question number 29. SpO2 indicates option A percentage of oxygen in blood, option B percentage of free hemoglobin, option C percentage of oxyhemoglobin, option D is respiratory rate. SpO2 indicates percentage of oxyhemoglobin. SpO2 indicates percentage of oxyhemoglobin. Question number 30. First stage of pneumonia is option A congestion, option B grey hepatization, option C is red hepatization, option D is resolution. First stage of pneumonia is congestion. The last stage of pneumonia is resolution. Question number 31. Hangman's fracture is option A fracture within the distal radius, B fracture at medial malleolus of the tibia and fibula, option C fracture of the base of the first metacarpal bone, option D is C2 C3 traumatic spondylolisthesis. Hangman's fracture is option D is right answer. C2 C3 traumatic spondylolisthesis is the right answer. Question number 32. What is the immediate goal of treatment of cardiac tamponade? Option A relieving pain, option B alleviating anxiety, option C is improving mobility, option D is relieving intrapericardial pressure. What is the immediate goal of treatment of cardiac tamponade? In cardiac tamponade, the immediate goal of treatment is relieving intrapericardial pressure. In relieving intrapericardial pressure is the immediate goal of treatment of cardiac tamponade. Question number 33. Defibrillation should be given when patient is having option A atrial fibrillation, option B ventricular tachycardia, Option C, PEA, that is pulseless electric activity. Option D is SVT, that is supraventricular tachycardia. Defibrillation should be given when patient is having ventricular tachycardia. Question number 34. Capillary refill time is normally option A 1 to 6 second, option B 2 to 3 second, option C is 1 to 3 second, and D is less than 10 second. Capillary refill time, the normal is 1 to 3 second. Next question. Another name for cardiac pool images. Option A, Muga scan, MUGA. Option B, cardia MRI. Option C, thallium scan. Option D, cardiac PET, positron emission tomography. Another name for cardiac pool images, Muga scan. Question number 36. Normal hematocrit value in male is option A 10 to 24 percentage, option B 20 to 34 percentage, option C is 30 to 48 percentage, and D is 40 to 54 percentage. Normal hematocrit volume or normal hematocrit value in male is 40 to 54 percentage. Normal hematocrit value is 40 to 54 percentage in male. Question number 37. An 18-month-old child is noted by the parents to be angry about any change in routine. This child's temperament is most likely to be described as option A slow to warm up, option B difficult, option C is hyperactive, option D is easy. An 18-month-old child is noted by the parents to be angry about any change in routine. This child's temperament is most likely to be described as hyperactive. Question number 38. At what age child can eat food without spilling? Identify her gender, say her full name, can dress self with supervision. At what age child can eat food without spilling? Identify her gender, say her full name, and can thus self with supervision. Option A 2 years, B 3 years, C 4 year, and D 5 year. The right answer here is 3 year. By the end of 3 year, the by the 3 years the child can be able to eat the food without spilling, identify her gender, say her full name, can dress self with supervision. Next question. A person has not yet fully realized that social identity is or define their personality traits, and they are not actively seeking to is known as option A role identification, option B delinquency, option C negativism, option D is role diffusion. A person has not yet fully realized their social identity or define their personality traits, and they are not actively seeking to is known as, the right answer is role diffusion. Question number 40. Asphyxia neonatal means option A increase in oxygen and decrease in carbon dioxide. Option B decrease in oxygen and increase in carbon dioxide. Option C is increase in oxygen and increase in carbon dioxide, and D is decrease in oxygen and decrease in carbon dioxide. Asphyxia neonatal is defined as decrease in oxygen and increase in carbon dioxide. Question number 41. Fetal movement can be felt by the mother. Option A during the first trimester of pregnancy. Option B at 16 to 20 weeks of gestation. Option C is around 2 weeks before the date. Option D is by the end of 30 weeks. Fetal movement can be felt by the mother by 16 to 20 weeks of gestation. Fetal movement can be felt by mother by 60 to 20 weeks of gestation. Question number 42. Which among the following is the largest diameter of the fetal skull? Option A biparietal diameter, B is submentovertical, C is mentovertical, and D is suboccipital pragmatic. Which of the following is the largest diameter of the fetal skull? The right answer is mento-vertical is the largest diameter of the fetal skull. Question number 43. In gynecoid pelvis, brim shape is option A flat, option B round, option C is oval shape and D is square shape. In gynecoid pelvis, the brim shape is round shape. Question number 44. Implantation of zygote is facilitated by option A trophoblast, option B cortex, C medulla and D is blastocyte. Implantation of zygote is facilitated by trophoblast. Question number 45. Polyhydramnios is a condition when the amniotic fluid volume exceeds more than dash ml. Option A 1000 ml, B 1500 ml, D is 2000 ml and D is 2500 ml. Polyhydramnios is a condition when the amniotic fluid volume exceeds more than 2000 ml or 2000 ml. Question number 46. All are true regarding vernix caseosa except. All are true regarding vernix caseosa except. Option A secreted by sebaceous gland. Option B mixture of sebum and epidermis. Option C is appears like white covering over the skin and option D is it is distributed uniformly. All are true regarding vernix caseosa except the right answer is it is distributed uniformly. All other things are right. This is not correct. Question number 47. Tordite dyskinesia is produced by following except option A fluphenazine, option B haloperidol, option C chlorpromazine, option D is diazepam. Tordite dyskinesia, one of the important side effects of antipsychotic drug called extrapyramidal side effects is in having for fluphenazine, haloperidol and chlorpromazine, whereas diazepam is a sedative anti-anxiety agent which does not cause tardive dyskinesia. Question number 48. Olfactory and gustatory hallucinations are seen in option A depression, option B paranoia, option C temporary lobe epilepsy, option D is Alzheimer's disease. Olfactory and gustatory hallucinations are seen in option A depression, B paranoia, C temporary lobe epilepsy and D is Alzheimer's disease. The right answer is temporary lobe epilepsy. Question number 49. Behavior therapy is helpful in option A schizophrenia, option B agoraphobia, C is personality disorder and D is neurotic depression. In this four condition which is having very effective for behavior therapy. Behavior therapy is helpful for treatment of agoraphobia. And for question number 50. A dishonest person thinks other person are also dishonest. Defense mechanism used by him is option A projection, option B introjection, option C suppression, option D rationalization. A dishonest person thinks other persons are also dishonest. The defense mechanism used by him is known as option projection, introjection, suppression, rationalization. The right answer is projection. That is the end of 50th MCQ. Thanks for watching this video. Tomorrow we are trying to give another two videos which contains 50 MCQs. Tomorrow means I mean 6th of October. Thank you for watching Satu Carry Online Nursing Channel. Satu Carry Online Nursing Channel. Wishing you all the best for the Safdarjung Nursing Officer exam. Meet you with another video on 6th October 2018. Thank you. Bye.